Welcome to this explainer. Today, we're breaking down some absolutely critical federal changes hitting Medicaid or medical assistance right here in Pennsylvania. If you or someone you love relies on this coverage, you've got to pay close attention. The rules of the game are shifting fast, and staying informed is literally your best defense against losing your benefits.
Here's our roadmap for today. We'll cover the major Medicaid changes coming, the new 6-month renewal rule, work and community requirements, whether you're exempt, and finally, exactly how to get ready.
All right, let's jump right into part 1, major Medicaid changes coming.
So why is this happening? Well, these changes stem directly from a new federal law. Back in July 2025, Republicans in Congress passed a Medicaid bill, which President Trump then signed into federal law. Because of this legislation at the federal level, Pennsylvania's Medicaid program is now required to implement some pretty significant overhauls to how they manage recipients.
Let's move on to Section 2, the 6-month renewal rule. This is where we see a massive shift. Under the current Medicaid system, you generally renew your eligibility once a year. It's a standard annual process, right? But under the new rules, some adults are going to have to check their eligibility and renew every 6 months. That literally cuts your timeline in half. So, say you apply for new coverage and it starts in January 2027, you'll have to complete a renewal just a few months later in July 2027. Now, if you're already on Medicaid, your cycle won't shrink until after your next normal renewal, but make no mistake, this faster 6-month pace is absolutely on the horizon.
You are definitely going to want to circle these dates on your calendar. By September 2026, the Pennsylvania Department of Human Services, PHDHS, will start sending out official notices to the folks affected by these new rules. Then, just a short time later, on January 1, 2027, the new rules and renewal timelines officially take effect. Keep an eye out so you aren't caught off guard when those letters start hitting your mailbox.
Next up, Section 3, work and community requirements.
80. That is your new magic number. Specifically, 80 hours a month. To keep your coverage under the new rules, you've got to complete at least 80 hours a month of approved activities. Now, this doesn't just mean a traditional 9-to-5 job. It can be a mix of working, volunteering, doing community service, participating in a work training program, or even going to school at least part-time. The whole idea is that all of those activities need to add up to hitting that 80-hour mark every single month.
Or if you're looking at income rather than hours, there's an alternative route. You can meet this requirement if you earn a minimum monthly income of at least $580. And hey, if you do seasonal work where your paychecks fluctuate, your caseworker can actually help you calculate if your income over time meets this option. So there is a little bit of flexibility depending on how exactly you earn your living. But here is a crucial detail, and honestly, it's the biggest trap. Simply doing the work isn't enough. You must proactively report these activities to PADHS during your application or your renewal process. Think about it. If you're working those 80 hours or making that $580, but you don't explicitly tell PADHS that you're doing so, you will lose your Medicaid coverage entirely. You've got to communicate with them and prove you're meeting the standard.
Let's look at Section 4, are you exempt?
Let's start with who absolutely must meet these requirements. These strict new rules specifically target adults aged 19 to 64 years old who do not have a dependent or a child under 14 years old. If you fit into both of those buckets, meaning you're in that age bracket and you don't have a young child depending on you, these new 80-hour work and community requirements apply directly to you.
But you might be wondering, what if your life looks a little different? What if you're dealing with special circumstances, a serious medical condition, or raising a young family? Who does not need to meet these rules?
Fortunately, there's a pretty broad list of exemptions based on your family and background. You're exempt if you're a parent or caretaker of a child under 14 or if you're the caretaker of an individual with a disability. You are also entirely exempt if you're pregnant or up to 1 year postpartum. A few other exemptions include folks currently or formerly in foster care who are 18 or older, Native Americans or Alaska Natives, and veterans with a VA-determined total disability. So, if you fall into any of these categories, you can breathe easy. The 80-hour rule doesn't apply to you. Additionally, there are health and status exemptions. You don't have to meet the work rules if you're currently in treatment for an alcohol or substance use disorder, if you're considered medically frail or have special medical needs, or if you've been incarcerated in the last 90 days. Also, if you receive TANF and are already meeting their work requirements, you're exempt here too. But wait, here's a really critical detail to point out. Federal law specifically states that SNAP recipients are not automatically exempt from these new Medicaid work requirements. Just because you receive SNAP doesn't mean you're cleared from this new rule.
Which brings us to our final section, Section 5, How to Get Ready with Actionable Steps.
To ensure you don't miss any of those life-saving notices we talked about earlier, there are 3 steps you really need to take right away. Step 1. Update your address and contact info in your Compass account. You can easily do this at dhs.pa.gov/Compass or by using the My Compass PA mobile app. Step 2. If you happen to move, formally report your address changes to the U.S. Postal Service at usps.com/move, so your mail actually follows you. And Step 3. Sign up for DHS texts and emails at dhs.pa.gov/text to get the absolute fastest notifications directly to your phone.
As we wrap up this explainer, I want to leave you with a vital question to ask yourself right now. Are your contact details perfectly up to date with PA/DHS today so you don't unexpectedly lose your healthcare coverage tomorrow? These changes are coming incredibly fast, and a missed piece of mail shouldn't be the reason you lose access to your healthcare. Check your status, get organized, and make sure you are totally prepared.